Hi, everyone. This month we're going to talk about GLP-1 receptor agonists. A lot of my patients ask about Trulicity, Ozempic, Wegovy, Rybelsus, all of those medications. And so this presentation is used to answer those questions, the weight loss benefits, challenges, and alternatives. This presentation is created by Sarah Curtis, MD, and also by Tao Tran, MD. This is with Radiant Health Direct Primary Care. All right. So lots of different names. So Byetta, Bydureon, Victoza, Saxenda, Trulicity, Ozempic, Rybelsus, Wegovy, Mounjaro, Zepbound. So these are all injectable medications that we use for treatment of diabetes, and it's very effective. I've been able to personally get patients off of insulin by using these injectables. And the nice thing is some of them are daily, but others are once weekly, which makes it a nice alternative for patients. Um, the other thing is, other than type 2 diabetes, these medicines have been shown to reduce cardiovascular risk. And is Zepbound, for example, was recently approved by the FDA earlier this year for the treatment of obstructive sleep apnea with obesity. So we can use these medications in children as well with type 2 diabetes as young as 10 years of age, and that's in Victoza. So these medications have been very helpful, and a lot of patients use them for weight management. So let's talk a little bit about that. So, GLP-1 receptor agonists are a class of medications that mimic the glucagon-like peptide 1 hormone in the body. And it was originally developed for type 2 diabetes and shown efficacy at promoting weight loss. So, it does this by enhancing insulin secretion in response to meals. It suppresses glucagon release, reduces hepatic glucose production, slows gastric emptying, increasing satiety, and acts on the brain to reduce appetite. So to summarize that, what that means is, when you eat something, sometimes in type 2 diabetics, they don't recognize that. And so essentially insulin's not sensitive and it doesn't secrete in response to food appropriately, and you can't metabolize the sugar. So the sugar doesn't go into the tissues and nourish the body, but it just hangs out in the blood vessels where it's not supposed to just stay. And then these GLP-1 agonists also suppress glucagon release and reduce the liver's production of sugar. So some patients ask, hey, I haven't eaten anything. Why is my sugar still high? It's because the glucose is actually produced by your liver. And these GLP-1 agonists prevent you from, it reduces that production. It also slows gastric emptying, which means that you are not emptying your stomach contents as quickly, so you feel fuller longer, and that sends a feedback to the brain saying, hey, I'm not as hungry, so the appetite is also reduced. The three main players, semaglutide, tirzepatide, and liraglutide. So what we found is that the STEP trial, which lasted 1 year and 4 months, showed that semaglutide was able to decrease 15% of patients' weight. And then the SURMOUNT trial, which lasted 72 weeks, which is 1 year and 5 months, showed a 21% weight reduction. And liraglutide on the SCALE trial showed a 9% weight loss. So a lot of my patients are on semaglutide or tirzepatide because they are very helpful with the weight loss. As far as the benefits, they improve blood pressure, cholesterol, reduce cardiovascular events in some trials, and then most importantly, they provide this non-surgical alternative to bariatric procedures. A lot of pre-diabetic patients go on this to help with weight loss and diabetes prevention. But despite their promises, GLP-1 agonists are expensive and not without side effects. So, gastrointestinal symptoms are most common, including nausea, vomiting, diarrhea, and abdominal pain. As far as the cost, these are very costly. A lot of the drugs are still patented. The reason why we were able to compound these medications was because there was a national shortage, but the national shortage has ended. So a lot of these compounded versions are no longer going to be available. And we'll talk about that later um, in detail. But some other long-term side effects include gallbladder disease. So we do see some patients get gallbladder infections or gallbladder stones. Of note, patients who already have existing diabetic retinopathy, you see that sometimes there's an increased risk of diabetic retinopathy complications when people use this drug. Patients who already have a fast heart rate may not benefit from this because it can increase baseline heart rate. Patients who are on insulin or sulfonylureas like glimepiride or glipizide, you have to be careful because sometimes, in addition to those, if you add this, it can actually cause you to go low. You can experience hypoglycemia. There is a theoretical risk of medullary thyroid cancer, and based on mice studies, but not consistently demonstrated in human studies. And I wanted you to know that there are other, forms of thyroid cancer, like follicular or papillary thyroid carcinomas, cancers that are not linked with GLP-1s. But severe gastrointestinal side effects like nausea, vomiting can lead to dehydration, and dehydration sometimes can lead to acute kidney injury, particularly those who already have pre-existing kidney impairments based on their diabetes. So things to think about. There's still a lot more long-term side effects. One other thing is sometimes you do see waste of lean muscle mass. So some patients will see that their facial features are different because you can more prominently see when you lose facial muscle mass. The cost for these can be very expensive, as you can see on this chart here. But the pricing at our local Vandalia pharmacy are going to be much cheaper. So Ozempic and Wegovy are both semaglutide. And 1 month supply for pre-filled syringes cost $199 for any dose. Mounjaro or Zepbound are both Tirzepatide, and a 1 month supply would be $249 for the 2.5, 5, and 7.5 milligram doses, and $299 for the 10, 12.5, or 15 milligram doses. So they're not inexpensive medications. But we'll talk about the compounding in the next slide. So, Ozempic, which is semaglutide, um, is the most commonly compounded injectable form. It's not oral. And these their state licensed pharmacies are required to stop compounding April 22nd, 2025, and outsourcing facilities, the 503Bs, compounding must stop by May 22nd, 2025 because the national shortage. Has ended for semaglutide. And for tirzepatide, the state licensed pharmacies stopped compounding February 18, 2025, and the outsourcing facilities stopped March 19, 2025. The medications that have already been compounded by these dates may continue to be sold, and our local pharmacy has enough supply for the compounded GLP-1 agonists to last until the end of 2025. Um, so, even though that these are cheaper compounded. Sometimes if you were going to buy cash, like if insurance isn't going to cover these medications for you and you pay cash, it's going to be more expensive. So Zepbound, for example, is going to be available, and that's a tirzepatide at $349. That's a 2.5 milligram dose, and $499 for the 5, 7.5, and 10 milligram dosages. So, after, 2025 to 2026, if your insurance covers these, then great. If your insurance doesn't cover it, then it may be very expensive out of pocket. So $350 to $499 if we're going to pay for these cash. Now, it's good to know that most of these medications will require prior authorizations, which are forms that your doctor has to fill out with your medical information to answer questions for the insurance companies. But also that obesity, if you have a comorbidity like obstructive sleep apnea may get that Zepbound covered. As far as diabetes, a lot of places will cover this if you are on one other medication and fail. Some require two, some require three. It just depends on the insurance company as to how many failed medications you have to have before one of these become covered for you. So yeah, so the big question is, oh, do I have to be on this forever? So discontinuing GLP-1 therapy has been led to weight regain proportional to the original weight loss. So we see here that just within, these studies saying within weeks to months after stopping, the average weight regain of semaglutide is 2.2 and then 9.69 pounds for the other ones. Um, we see that lifestyle modification really has to be paired with this to get the biggest benefit. Because if we use this as a crutch, so to speak, the weight will come back if we stop the medication. And then alternatives for weight loss. So we have bupropion, naltrexone, phentermine, topiramate, or forglipron, and lifestyle intervention. So these medications, you can talk to your um, doctor about. In recently, April 2025, danuglipron was actually discontinued due to drug-induced liver damage found in studies. Um, so that is no longer available. Lifestyle interventions. Tracking food intake and physical activity enhances awareness and accountability. So, goal setting, establishing specific, measurable, and achievable objectives fosters motivation. So, when you come talk to your doctor, just set a goal. Say, hey, one thing that I can do, maybe it's drink one more cup of water a day, or decrease one bag of chips a day, or, cut back by one alcoholic beverage a night, could be helpful. Cognitive restructuring, so identifying and altering negative thought patterns related to eating. Stimulus control, modifying the environment to reduce cues for unhealthy behaviors. So just don't buy the foods that you know you may want to eat at nighttime when you wake up for a snack. Problem solving, developing strategies to overcome barriers to healthy behaviors. Um, Dietary modifications. So they say that if you're able to lose 500 calories per week, then you're able to lose 1 pound per week. 500 calories is equal per day. I'm sorry, per day is equal to 1 pound loss per week. So structuring your diet or physical activity to help with that. They say physical activity guidelines 150 to 300 minutes per week of moderate intensity, or 75 to 150 minutes of vigorous intensity aerobic activity, and incorporating strength training, resistance training to help preserve the lean muscle mass is going to be really helpful as well. So, these are things that you've probably heard before. So, 500 calories per day, 150 minutes per week, avoiding food items in the home that may lead to cravings, and then just setting small goals and reaching them. So, final thoughts. GLP-1s are highly effective for weight loss. They are limited by cost and access, but there's a lot of research for new medication options as well. And the key is to use these with lifestyle and dietary support. So, thank you for watching to the end. And thank you so much, Dr. Sarah Curtis, to help with this presentation. And we'll see you next month. This is Dr. Tran. Bye bye.